Good afternoon, everybody. I'm just going to give it another couple of minutes for some more people to join, and then we will make a start. Give it one more moment and then we'll get cracking. Okay, I think we'll make a start and any others can join as we go along. So thank you everybody for joining this evening. This is an AHDB Pork focused webinar on African swine fever and essentials and guidance for abattoir staff focusing on England. I'm Miranda Poulton. I'm a senior animal health and welfare scientist in AHDB's animal health and welfare team. And I'm joined this evening by Rocio Martinez Hidalgo, who is the Notifiable Disease Portfolio Lead in FSA Operations, and Agnieszka Dobrowska, who's a veterinary advisor at the Food Standards Agency. We were expecting to be joined by Janet Dixon from DEFRA, but she's unfortunately not able to make it. She's not very well today, so she sends her apologies. If there are any questions at the end of the webinar that AHDB and the FSA are not able to answer between us, we will take them away to Janet and make sure that they get answered at a later date in the next few days, hopefully, once she's better. So please don't not ask a question because you think that DEFRA aren't here, and they will be able to pick it up. So I just have a few housekeeping slides. All of you are muted and have your cameras turned off, so we can't see or hear you. The webinar is going to run for up to an hour, so we should be done by 6 p.m. And the webinar is being recorded and is going to be made available after the event. So everybody should be emailed a recording within the next 24 hours or so. And further down the line, it will be made available on AHDB's website and on our YouTube channel. We also hope to translate it into some other languages to make sure that it's accessible to as many people as possible. If you want to ask us a question, there is a little question box in the top right of the screen. So it's a little speech bubble with a question mark in it. If you type your question into that box, it will come through to me and Rocio and Aga, and we will be able to pick that up. Anybody else can't see the questions that you've asked, and all of the questions will be asked anonymously, so we're not going to shout your name out. So, African swine fever. It's a highly contagious and deadly viral disease that affects all pigs, all species of swine. So in England and the UK, that means domestic pigs and also feral wild boar. And it can cause up to 100% mortality in pigs, and especially in the case of severe strains. If the disease were to be detected in England, there would be mitigation measures put in place, which would include culling on affected premises and restrictions on the movement of pigs, pig meat and products, so that's also things like semen. The virus is very resistant in the environment. It can remain active for months or even years in pig meat, even in temperatures as low as -70 degrees centigrade. So freezing does not kill the virus reliably. There's no vaccine currently available in the UK. There are vaccines that are being trialled and experimented on, but nothing currently available for general use in the UK. We know that over recent years, ASF outbreaks have had a really significant impact on the global pig industry and a lot of national economies. It's circulating at the moment in many Asian and European countries and also in some African countries. It has never been detected in the UK, but it is actively spreading in many countries in the world, as I say. The UK government and industry are actively monitoring to see if it does enter the UK. We hope not, but it is being monitored for, and we're also working with all parts of the supply chain to try to prevent its introduction into the country and into our pig sector. It's important to say that ASF does not affect humans, and it's also not a food safety hazard, so it only affects pig species. It can be transmitted by both direct and indirect contact with infected animals, or with contaminated equipment, vehicles, or pork products. So that's everything from meat to semen and other germinal products. It's not, however, spread on the wind, which is the case with foot and mouth disease, but it's not windborne in the case of ASF. So it's only spread by contact with an infected animal or with one of their secretions, urine, feces, or blood, or a meat product. In terms of the clinical signs that you would see in an affected pig, you might see a very high fever, 40 to 42 degrees, a loss of appetite and lethargy, red or darkened skin, especially around the ears, the snout, the belly, and the legs. You may see vomiting and diarrhea, which may also be bloody, laboured breathing, coughing, discharge from the eyes and nose, weakness and an abnormal gait, abortions in sows that are pregnant, which you shouldn't see in an abattoir, but if you do spend time on farm as well, that's a sign to be aware of. However, it's really important to say that the symptoms are often very subtle and non-specific, and you may see absolutely nothing at all except for sudden death, often with few or no signs beforehand, and it may only be in a very small number of pigs. So while you may see signs that look quite typical, you may also see signs that are very non-specific. So you should have African swine fever on your list of suspicions whenever you see pigs that are not well or themselves. We get asked quite a lot when we're talking about African swine fever, which organisation is responsible for what. So I felt that it would be useful to touch on that here. DEFRA are the lead government department for animal health and biosecurity in England. It's their job to look after all of the legislative and policy guidance and documents that go along with notifiable diseases. They also oversee APHA, and they coordinate responses to notifiable disease outbreaks, including African swine fever. They provide guidance on identifying ASF and other notifiable diseases, and they're also who you would report to if you have a suspicion that you may be seeing a case. And they then collaborate with other agencies to manage outbreaks. The Animal Plant Health Agency, or APHA, are the operational wing of DEFRA, and they're responsible for both monitoring and surveillance of the disease before there's an outbreak. So they're in charge of checking to see that we don't have any disease in the country, but also controlling and responding to an outbreak. So they would conduct surveillance, they provide diagnostic services and support outbreak response efforts. And they work very closely with DEFRA to make sure that control measures are properly implemented during outbreaks. Then finally, the Food Standards Agency oversee the food safety and consumer protection matters in England, Wales and Northern Ireland. So while we have said that African swine fever is not a human hazard, it's not a food safety hazard, they would still be in charge in an ASF outbreak of assisting with traceability and trying to find product that might be affected. They would work with DEFRA and APHA on that and other control measures. So that's who is responsible for what during an outbreak. So in the case that there is a possibility that African swine fever could be detected for the first time in an abattoir. We know that in the 2001 foot and mouth outbreak, it was actually detected in an abattoir to begin with. So we always keep in mind that abattoir staff are key parts of the surveillance network. If you do see an animal that you think looks unwell or is suspicious, we would in all cases urge you to contact the official vet on site. And then if the OV is sufficiently suspicious or worried, then they would pick up the phone and contact the DEFRA Rural Services helpline upon suspicion of the disease. So it's really key in a notifiable disease situation that it's a legal responsibility to report to DEFRA if you suspect that there may be a case. It's not about waiting for confirmation. You must telephone if you have a suspicion. Over the phone, the veterinary inspector at APHA will assess the evidence that they're being told about, and they may impose verbal restrictions over the phone to say, halt what you're doing, no staff, vehicles or animals in or out until we get there to conduct an investigation. And the veterinary inspector would be dispatched by APHA to the abattoir to investigate. Those restrictions that they implement over the phone are likely to include no movement of pigs, carcasses, product, or other potentially contaminated items, isolation of the suspect carcass, and a halt to slaughter proceedings. And the other thing that is really key here is that staff will not be allowed to leave the abattoir until the APHA veterinary inspector arrives. They aim to dispatch a veterinary inspector very quickly, but it may be some time before you're allowed to leave. So that's a possibility to be aware of as well. There'll be heightened biosecurity measures that are required for anybody who's in contact with a potentially affected pig or carcass. And when that veterinary inspector arrives, they will issue written notice of the restrictions that they've issued over the phone. And that is the point at which they may start licensing people to leave the premises. If the disease cannot be ruled out, the veterinary inspector would issue a notice of suspicion, and that for abattoirs, that notice is distinct from the notice that would be issued for a farm. The restrictions might be extended, so no movement of pigs, carcasses, or indeed any animal that's likely to spread disease. There would be no further slaughter unless it is authorised, and suspect carcasses must be fully isolated. And a suspect carcass is not just the one that you think may be affected, but also carcasses that have come from the same farm or that have been in contact in the slaughterhouse. So, for example, if they've been stored next to each other in the chiller, then that would be considered an in-contact carcass that would have to be isolated. And the veterinary inspector might take samples from pigs, carcasses, and various other items to send away for testing. Our hope would be that after all of this investigating, that the disease is ruled out. And if that's the case, all the restrictions are lifted and normal operations resume. There's no further action that's taken. However, if the disease is confirmed, so this would include African swine fever, classical swine fever, swine vesicular disease, and foot and mouth disease, all pigs that are in the abattoir would be slaughtered immediately under the veterinary inspector's supervision. Infected or suspect carcasses would be destroyed as category 2 material in sealed containers. And then there would be cleansing and disinfection of the slaughterhouse according to instructions that would be issued by that veterinary inspector, and it would be done under their supervision. Then an epidemiological inquiry would be started. So that's essentially a tracings operation. So where do we think that this case has come from, but also where else could it conceivably have spread to in the period of time before it was noted at an abattoir? And then once that inquiry is completed and there's been sufficient cleansing and disinfection, a further 24 hours after that has happened, the restrictions are lifted and the abattoir is able to resume operations. Movement restrictions are a really significant part of African swine fever control. And in the UK, notifiable diseases must be reported to APHA. And there are a very wide variety of them, not just African swine fever. In the case of a notifiable disease outbreak, to stop the spread of the disease, movement restrictions would be implemented, and that concerns, as I've said, not just livestock, but also livestock products, people, equipment, vehicles, etc. And following on from that, we would have control zones in affected areas with a licensing system to permit the movement of products and animals under certain circumstances only. In the case of African swine fever, if it were found on a farm, we would have a control zone pattern that looks like this. So in the center, you have an infected premises. This is the area where the disease is confirmed. And then around that infected premises, you would have a 3-kilometer protection zone with very strict movement restrictions and biosecurity measures, and then a 10-kilometer surveillance zone. So that 10-kilometer zone would include the protection zone, and it has strict surveillance and some movement controls in there as well. But essentially, the further away from the infected premises you are, the more relaxed the movements would be. In terms of abattoirs and the things that processing staff need to be aware of, the most important thing is pre-designation and designation. So designation is an authorization for an abattoir to operate during an outbreak of an infectious exotic animal disease. It effectively acts as a guarantee from the slaughterhouse that the abattoir can operate to a required standard that mitigates disease spread. So it's above and beyond normal operations, but the abattoir guarantees that they are able to meet those requirements. And it allows the conditions of movement, licenses, etc., to be met. And these license conditions include the movement to that designated slaughterhouse. So an animal cannot go to slaughter unless it's going to a designated slaughterhouse. We also have pre-designation. So pre-designation is what many slaughterhouses and cutting plants will currently be going through. It means that the abattoir has got the procedures and facilities in place that means that it would be able to comply with the conditions during an outbreak to continue operating, but those conditions do not need to be met right now. It can be quite a lengthy process to go through pre-designation. So we go through it now because it makes the designation process much quicker should there be an outbreak. You don't need to comply with any of the conditions until an outbreak is confirmed. In the event of an outbreak, the food business operator, so the slaughterhouse or cutting plant that is pre-designated, would contact DEFRA or Welsh Government to request the activation of that designation. That application will be assessed and the authorization will be granted if appropriate. It's very likely that that would be granted if you're pre-designated. There are two levels of designation for slaughterhouses, and I would urge everybody listening, if you are working in a slaughterhouse, to find out which level you are or you plan to be pre-designated to, because it will affect what animals you can accept during an outbreak. Level 1 designation is designed for slaughterhouses that are operating inside those protection and surveillance zones, which is why we've showed you that diagram, but they're only processing animals which have been kept exclusively outside those zones and have only moved into them for the purpose of being slaughtered, and these are referred to as non-controlled animals. So they're animals that have been reared and lived outside the zone coming in to be slaughtered. A level 2 designation is for slaughterhouses that are running either inside or outside a zone, so the geography is not important, but they're processing animals that have been kept inside a protection or surveillance zone, and these are referred to as controlled animals. So they won't be animals that have come from an infected premises, but they will be animals that have been kept in a surveillance or protection zone that have been licensed specifically to go to that designated slaughterhouse to be killed. It's important to note that slaughterhouses, cutting plants, cold stores, and other treatment facilities all need to be designated and pre-designated separately, even if they're on the same site. So if you have on your site a slaughterhouse and a cutting plant, they would both need to be pre-designated and then designated separately. I want to spend a bit of time talking about what you might expect during an ASF outbreak as a person working in an abattoir. It's likely, even if the disease is ruled out, that the abattoir would face either a temporary closure or a temporary halt of operations while the investigation is going on, and that would happen pretty much immediately from the moment the phone call is made. The time it takes to reopen the abattoir varies quite a lot. It depends partly on the tracings, and it also partly depends on how many affected animals there might be and how easy it is to and how quick it is to clean the abattoir down. If the abattoir cannot meet designation requirements and it is located inside a protection or surveillance zone, it will not be able to operate unless and until that zone is revoked. So if you're not designated and you find that your slaughterhouse is located inside a control zone, it won't be able to operate. Staff working in abattoirs might need to assist with a variety of different operations to normal, and that might include disease control measures like handling condemned carcasses, intensified cleansing and disinfection protocols. You will need to follow enhanced biosecurity protocols, so stricter hygiene, movement controls, which will prevent further spread, and that will include changing clothes, disinfecting yourself and equipment. As I've said already, there will be restrictions on leaving the abattoir in the immediate aftermath of that phone call being made until the APHA vet arrives and grants a license to be able to leave. And crucially, if you are visiting or working at another farm or another abattoir or food processing unit, you must discuss this with the food business operator with whom you work. It's generally not wise to be working on a farm and then in an abattoir, and that would be heightened, especially during a disease outbreak. So what do you need to do? Make sure you stay alert for all of those clinical signs that we discussed at the start. If you see anything that you think is suspicious, either speak to your OV, or if you are an OV, pick up the phone and call DEFRA, and they will investigate. Make sure you have the OV's telephone number as well as the DEFRA Rural Services helpline phone number. If you do suspect a case of ASF, you will need that number. Follow all your biosecurity protocols to prevent disease introduction and spread. Always make sure that you're following PPE guidance, using PPE, disinfect boots and equipment appropriately, and avoid contact with pigs from different sources where you can. And most crucially, look out for yourself and your colleagues' well-being and seek help if you feel overwhelmed during an outbreak. It's an intensely stressful period of time for everybody involved, and looking after your mental health and well-being is essential. There are a wide variety of resources available from AHDB. We have an ASF hub on our website, which acts as a central resource that links out to numerous different resources. So we have web pages with information on frequently asked questions, clinical signs, how to reduce risk and how to prepare. We also have webinars and videos on keeping ASF out and contingency planning, resources, posters, etc. for both farms and abattoirs. And we also link to all of the relevant government resources and websites. So the link to that is there, but also if you just Google AHDB ASF, it's pretty much the first thing that comes up. And in due course, that page is where this webinar will be posted. Key take-home messages then before I open up to questions. African swine fever has never been detected in the UK, but it is spreading actively in parts of Europe, Asia and Africa, and we all have to remain vigilant to detect it as soon as possible. And we cannot ignore the possibility of an outbreak occurring in the UK. There is currently a ban on bringing pork and pork products from the EU to the UK, and it's not just pork, it's other meat products and dairy as well in light of recent foot and mouth outbreaks. Abattoir staff travelling abroad to countries with ASF and could have contact with pigs must follow appropriate biosecurity measures before they return to work. And every ASF outbreak would be managed individually. It's extremely case by case. So while what we've talked about, or what I've talked about this afternoon, is the broad brushstrokes of what would happen, ultimately every outbreak is individual, and the exact sequence of events and the exact amount of time that it would take to return to normal is case by case. So we'd have to consider factors like the affected animal type, whether it's occurred in domestic pigs or wild boar, where the outbreak has been detected, whether that's on farm or in an abattoir, the location, and also the findings of the APHA investigation, which would include how widely it might have spread. And also the level of restrictions depends on the situation, and again is decided case by case. So that's everything that I had to say. I've got a couple of questions just filtering in through the chat, so I'm going to stop sharing my screen, and hopefully Aga and Rothio will both have their cameras on, and I will start posing questions to them. Before I open up the floor to questions though, I do just want to say that it's important to note that African swine fever is a really evolving situation all the time. There are questions that we don't know the answers to, or protocols that are currently in development and they haven't been finalized yet. And there sometimes do come up questions that we don't know the answer to. So if we don't know the answer to a question, we will tell you, but we will take the question away and find out the answer. And any questions that we're not able to answer in the webinar today, including questions for DEFRA, we will take them away and they will be answered by follow-up. So I'll stop sharing my screen. I've got a couple of questions in the chat to start with. The first question is, in a multi-species abattoir, if there is no designation for pigs, is the abattoir still able to process other species? And perhaps around that, could you share any further information about operations of multi-species abattoirs during such an outbreak?
Shall I go? During an African swine fever outbreak, the measures in place will affect susceptible species. So, maybe at the very beginning of the outbreak, there is a complete ban. We don't know exactly what is going to happen, but I understand that the rest of the species will be able to keep processing. But as I said, at the very beginning of the outbreak, we will have, when I say we meet, DEFRA will need to assess the whole situation and maybe circumstances where there is another ban affecting movement at all. But I don't think that would be the case. Aga, do you know?
No, I think you're right. It would depend on the outbreak of the disease and the susceptible species. So if that's only African or Clascan swine fever, it's very unlikely that the other species would be affected. So that would concern pigs. Potentially, and again, that's probably something for DEFRA that we can refer it depending on the operations, if there can be differentiation operating under designations and without designations, if this not susceptible species are processed.
Mm-hmm.
I think that this question has come up in previous conversations because there are obviously multi-species abattoirs operating, and I also believe that it depends on the degree to which the processing lines and the chillers, etc., are separated. Because while for example, a beef carcass can't carry African swine fever in the same way that a pig carcass can, contact between them could lead to that beef carcass becoming contaminated. And if it were to become contaminated, then it would have to be destroyed. It couldn't go forward for further processing, etc. So it does in part depend on the setup of that individual abattoir and the extent to which separation can be maintained between the lines and the chillers and the products. So hopefully that's answered that question, but we will pose it to DEFRA as well and make sure that we get their viewpoint on it. The next question is, what would the impact be and control measures to take if ASF was detected, but meat had already been further processed into ham that had gone to retail? So I think this is a question about how far down the line would a tracing and recall operation have an effect?
Again, complicated question. It will depend very much, obviously. I suppose that we are talking about meat from the protection zone or the infected farm. The meat will need to be traced, that for sure, identified where the meat is, even if it has been treated. Then it will be a matter of doing a risk assessment when the disease was introduced in the farm. It will vary the period that it can vary the period that we need to take into consideration. Well, when I say we, I mean DEFRA and the epidemiological team in EPA, which meat need to be destroyed and which one it doesn't. But it will depend very much in the epidemiological information.
Do we know if meat that is on retailer shelves would be recalled, or is that not? I think in the case of ham in particular, the tracing is quite complicated, isn't it? Because it's not a single animal origin always.
Yeah, in terms of recall, I cannot answer that question. I'm sorry.
We will pose it to DEFRA.
I'm sure that we need to identify what it is. Getting back from the shelves, the meat. We need to take that away.
There are no other questions in the Q&A box at the moment. Please do pop them in if you have any questions. Otherwise, Rocio and Aga, are there any areas that you think that... Oh, I want another one. Oh, there we go. Am I correct in understanding that pigs coming from a control or protection zone will have to be treated and cooked?
Yeah, that's correct. They need to be treated and cooked with an approved method in a designated treatment plant. Yes.
Yes, that's my understanding as well. So I hope that answers that question, actually, a fairly simple one for once. but there is a list of approved treatment procedures in the legislation. So as part of its pre-designation and designation process, the treatment facility would have to demonstrate that they're able to carry that out to the required standard. While we're waiting for any additional questions, Rothio and Aga, are there any other things that you would want to add to the presentation, or any questions or things that you think that those watching should know?
No, I think that the presentation was quite covered quite a lot of. I mean, it was quite complete. Just as you mentioned, to take away, be vigilant. I mean, and obviously maintain biosecurity, cleaning and disinfection is important. It's something that we need to do every day, not only when we are preparing for an outbreak. So just I mean, be vigilant, please. That's all.
Yeah,
we are at the moment in I mean, the risk for the UK is medium. It has been for a while now, for a couple of years, but still, this is something that we cannot forget about.
Yeah, I think that's the biggest take-home message, isn't it? Is just to be on the alert, follow all your biosecurity protocols, and if you see anything that you think is suspicious, make sure somebody knows about it.
Probably also from my side, the things that they are well known, but have to be just repeated, that sticking to the import controls and the ban on the swill feeding, because if those two routes are stopped, there's not going to be epidemiological pathway of the introduction. So they are very important as a control measures, really.
Yeah, and I think that that's also something that's really key, is the swill feeding ban, and just generally being careful about products. So we've had questions from others previously about if it's not a food safety hazard, why are we so concerned with tracing product? And the answer is because of the risk of it getting into the pigs by accident, even if people are not, you know, breaking the swill feeding ban. That's why we're so concerned. I don't have any further questions in the Q&A box at the moment. If you do have any further questions that you think of after the, having said that, I have just got one more. This is definitely one that you'll be able to answer. Are site OBs receiving additional training to help identify cases?
Well, to help identify cases, we ran a session, when was that? In April this year in FSA, that was cascaded to the OBs. I mean, it was in particular to designations, because the new designation form was, the new designation form for exotic disease was released. We covered a bit there, did we cover? No, we didn't. No, sorry, we had done a previous one specific on African swine fever a while ago. The one that we did in April was only for designations and reporting of notifiable disease, and the important role that the OBs have in identifying these, I mean, raising the alarm on these cases. But yeah, they have their training as the OBs.
I can add to that as well, that obviously when we had outbreaks of the foot and mouth disease in Europe, then we've been sending quite regularly alerts to the OVs on updating them on the situation of safeguard measures, but also reminding them in terms of foot and mouth disease what to be on the lookout, and particularly now with the blue tongue, differential diagnosis, and what is the triage in APHA, etc. So OVs are updated by us quite regularly, depending what the threats are. And Rocio is right, we did run on African swine fever webinar, I believe it must have been a year and a half ago, which we've got obviously recorded as well, I think, on a platform, so it can be repeated anytime with the new information as they evolve.
And from me, a sort of related question is, have OVs been offered training to help guide them through the pre-designation process for slaughterhouses and cutting plants, because they're quite key in ensuring that that process can be carried out and the pre-designation get granted?
Yeah, that was the particular training that we did back in, I mean, we have done it with other diseases, but in particular with the African swine fever and other exotic diseases that was delivered back in April, when we had the new forms for African swine fever, foot and mouth, and covering several notifiable diseases in red meat species.
Okay, that's great, thank you. Again, I've got no more questions at the moment. I did pop briefly up on the screen, but just want to reiterate that AHDB's pig health email address, which is pig.health@ahdb.org.uk, is monitored by numerous members of our team. And if you do have any questions that you think of after this, or indeed at any time, then you should feel free to send us an email with your question, and we'll do our best to get back to you. But frequently asked questions, particularly around abattoir and cutting plant-free designation, are on AHDB's website already, so you may find that your question has already been answered there. Since there are no more questions in the Q&A box, I am going to draw the webinar to a conclusion. I think that you will get a feedback form emailed round to you after the webinar. We would be grateful if you did fill it in and just let us know any thoughts that you have. And the recording will be made available to those that registered in the next day or so, and for others in the coming week or so. I want to say thank you very much to Rocio and Aga for their time this evening. And that is everything, I think. Still no questions. So if that's the case, then I will ask Kyle, who is in the background, making sure all the tech works for us. So big thank you to him as well, to wrap the webinar up. Thank you, everybody, and have a good rest of your evening.
Thank you very much. Bye.
Thank you.